Welcome, everyone. Welcome once again to In Touch. Dr. John Nowicki is with us, Nowicki Chiropractic and Wellness. Good to see you, sir.
Thanks for having me back. Appreciate being here.
I would do that, yeah. I'll be back, sure.
Excellent. Excellent. Well, you were here at my office last week for
Yeah.
Patient Appreciation Day. Wow.
That was a good one.
Yeah, the school supplies keep piling up.
Good.
We'll be done with that tomorrow at 6 o'clock. So if anybody out there still has school supplies that they want to donate, get them to our office. We'll be taking the supplies that we finished collecting a couple days before this plays over to a couple local schools to donate them. There's a lot of needy children out there, and we'd be happy to deliver them for you. We're a convenient location right next to Home Depot there on US 2.
Sure.
And, speaking of school supplies, this is that startup time of year where you've got soccer kicking in, which isn't really thought of as a contact sport, but it's definitely a collision sport with the ground, with other players. And contact, yeah, when kids, bump heads, coconuts out there on the field, I know I did when I played, you can cause issues. So it's not just football that causes these issues that are all in the news right now.
Yeah.
And of course, the issue we're talking about is concussion, right?
Right.
And the long-term sequela of that is this chronic traumatic encephalopathy that results in all kinds of problems, behavioral problems, violence. There was just a video out there, I think the guy's name was Pride or Price. He was a lineman, and he went nuts in Michigan somewhere and literally jumped and drove himself right in front of the cops. They had the cops recording played on YouTube of him going through a glass door. Just ran away from the cops and ran through a glass door. I haven't seen it yet. I got to Google it. But, there's a guy that had lots of hits to his head, and it's a cumulative effect. Every hit counts. All right? Every hit counts. And the best way to defend your child's brain health is giving him or her, and folks out there, ladies get concussions, girls get concussions per hour more often in the same sport than guys do. Okay, so it's one of those misnomers, misconceptions out there. But the best way to give your child the ability to play safe is to give them a gold standard baseline test. And that's what we do at our office. It's the newest one out there. It's cleared in the USA, Canada, the 28 countries of the EU, Australia, New Zealand. And it gives you a baseline that then when that child, your child is out on the field and they have an event, a hit to the head, they're wobbly kneed afterwards, they have a concussion, they have a headache, they just can't think straight, their grades go down. Hey, you can bring them back in and we can tell you where they're at, when it's safe to get them back to play. We need to get them back to where their baseline was. Now, if you don't have a baseline, it's way trickier. All right, it's way more work. You got to be way more conservative. All right, and frankly, the baselines that are out there, the impact test, the best test, that's what the NFL uses. And if you want NFL results, I don't. Look at what they're getting.
Sure.
Lawsuits and vegetables for adults.
Yeah.
That's not what you want for your child. This is your child's brain we're talking about. Okay, so we do these in the office. Basically, it's handled as a full-blown screening. You come on in, we do the baseline test. If all's good, super, we don't have to dig any deeper. But if we do have to dig deeper, there's some testing that we do beyond that. We do a physical exam of the neck. Why the neck? Because when you have a concussion, it's virtually indistinguishable from an upper cervical sprain. All right? The C1, C2, the top two bones in your neck.
Right.
And that's really what perpetuates these problems. Sidney Crosby, hockey player, won the Stanley Cup again this year with the Penguins. He was out for a year and a half, been through all the normal testing, been through all the medical care possible, PT, whatever, everything the trainers had him do, and he was still not playing. And then he went through and did what we do in our clinic, an evaluation of the upper cervical spine, a chiropractic examination, and he's back to playing. And again, just won the Stanley Cup. So if you want those kind of results, those performance-enhancing results, give us a call, 779-1300. That's really where the cutting edge is at this point in concussion care. So we offer what we call a concussion roulette workshop. It's a 10-minute talk. We're going to be doing it at one of our local schools here next week, and we end the ambiguity. We increase safe playing time and put an end to concussion roulette. What do I mean by concussion roulette? Concussion roulette is your child going out to play before they've fully healed from a concussion, having another one, and having their brain swell and die on the field. There were 16 kids on the field that died last year from that. All right, terrible situation. But it's more than that. All right, it's other issues, behavioral issues, grades getting lowered, increased risk of other injuries. That's a performance issue, right? You get a concussion, you have increased risk of knee injuries. We'll talk about the mechanics of that and how that happens in our 10-minute talk. And why head traumas, concussions, can really give you not only the decreased acuity for school grades, okay, increased injury of extremity joints, but also digestive issues can come from that. And we'll talk about the cascade of events that bring that on. So this isn't just a brain injury. It's not a dinger, all right? This affects the whole body, all right? So if your child's been exposed to these hits and you want to give them the best chance of participating safely again, or if they're just not the same child after playing collision sports, they've changed in some way that you're not happy with, it could be that hit to the head that was never diagnosed as a concussion is still affecting them. Okay? And that's where our testing, our examinations, and when you're dealing with an upper cervical problem, you look at the gold standard for diagnosing ligament damage up there, and that's flexion extension x-rays of the neck. So we'll take those specific x-rays that are truly the what was done to help Sidney Crosby get back in the game. Okay. It wasn't that his concussion wasn't healed, it was that the symptoms of the concussion were being perpetuated by an unhealed upper cervical injury, an upper neck injury. Okay.
If you are, you hit several times in the head like that, can this be permanent? I mean, there's no way of mending it then?
Yeah, that's what the exam, the case history, and so forth helps bring out, how long you've had it, how severe it is.
Sure.
And, if there's an upper cervical injury that we can treat, okay, to get rid of that miscommunication, that mismatch is what they call it, between the brain and the body, to allow the body to function better, then we can give you hope. But we only know whether that's permanent or not until we give it a trial of care.
That's true.
Okay? But most of the patients that have come in have seen dramatic improvements. There's no guarantees, except that I'm going to give you our very best care and very best advice. I'm not going to waste anybody's time or money when you come in my office. Okay? Some patients don't really care for that. They want everything sugar-coated. Not in my office. I'm going to tell you where we're at. For instance, with these concussions, man, you need to know that it's increasing your child's risk of blowing out a knee if they're not fully recovered. All right? And that's loss of scholarship, that's depression. You blow an ACL and it's a game changer. You may never play again. We've all known athletes that have never been back to play after a sprained strain. These are serious injuries, and that's what concussion sets you up for. A fourfold or 400 times or 400% increased risk of an ACL tear is where it pushes.
How are high schools treating this? Are they doing it positive?
Well, they're using the impact test in the areas, is what I understand. And again, that's what the NFL uses. And I understand they're doing something, right? But the research shows that it's just not as effective as we'd like to see. There's lots of questions about it, including the coaches. I've heard from numerous coaches that the kids are sandbagging it, meaning when they take the test, they dumb themselves down. They slow their reaction times. They dumb their answers down to make it easier for them to go back to play if they do get a hit to the head. Okay? So that means that the impact test is allowing them to go back to play when they really shouldn't be.
Right.
And that's what sets you up for second concussion syndrome. It's what sets you up for all these other injuries that go on, digestive problems, behavioral problems, academic problems. So your child deserves better than that. They really do. And, you know, if you're like, well, my kid's had the impact test, that's good enough. I get it. But if you're out there listening and your child has passed the impact test and you've been given the clear by the trainer or the doc to go back to play, but your child just isn't the same child, then we're a resource for you. We're a resource for you to come in, get that child evaluated from somebody who's got specialized training in evaluating the upper cervical spine and determining whether that's related to the symptoms that your child is still having.
And with children, and you mentioned girls, we'd almost completely forgot about that.
Yeah, it's all about football, right, is what you hear in the news, but it's not. Women get concussed at a higher level or a higher rate per hour in the same sport than guys do. So in soccer, women get more concussions. Okay? And what they feel is it's just morphology. A female body has less muscle mass per pound, per inch of height than typically a guy.
All right.
And it's the thickness of the neck that acts as a harmonic dampener when you have a hit to the head. So it somehow protects them. They're not really sure, but you know, just because you've got 3 girls and no boys in your family and the 3 girls are playing sports, you know, softball, soccer, whatever, they're snowboarding. All right, it doesn't have to be just high school sports we're talking about.
Well, you know about that, don't you?
Oh yeah. That's where I've had my experience with concussions, as well as car accidents. You know, I've been through quite a few car accidents and have had concussions from that. In fact, it was the last one that really got me interested in the issue and digging deeper when I found that I could get better with my concussion symptoms with the care that we now provide our patients in our clinic.
So there's all the sports that are stepping up and saying, yeah, we have the same problem. We have an issue here.
Yeah.
NASCAR, for instance.
Yeah, Dale Earnhardt, right?
Right.
You know, I'm less aware of what went on with him. Is he done? Did he retire?
After this year.
After this year, he's
Right.
done. He doesn't want another hit to the head.
Exactly.
All right. So, and I read about
His wife has stepped up to make sure he does not get another hit to the head.
Yeah, so she's protecting him, right?
Yeah, she
You know,
is.
if Dale Earnhardt came to our clinic, he would get the same evaluation that your children would be exposed to.
Sure.
All right, the examination, the physical exam, the baseline testing. Okay, he would get that. Plus, he would get the flexion extension views, the motion views, and then we would show you, okay, together, where those subluxations are, where your neck is not moving properly, okay? And we can even send out for what's called computerized radiographic mensuration analysis, which tells us where those ligaments are damaged, where the bones are moving too much, and need the specific rehab that, frankly, our clinic is set up to do, okay?
And with that said, it's, if anyone has a question,
Yeah,
contact your clinic, right?
absolutely. Give me a call at my office, 906-779-1300. And frankly, the exam is just $20. We charge $20 because your child's brain is more important to me, their health, than the money. And that $20 is going to get donated to the school supply drive. Okay? When that's done, we roll right into our collecting of money for the food pantries in the area. Okay, so it's never about the money getting that baseline. It's about giving you the best knowledge possible about your child's brain health and what you can do to protect them, or rehab them if they already are having problems from their collision and contact sports they participated in.
And being children and children being children, that can happen very easily.
Yes, it can. And they don't always tell you that they got a hit to that. They don't ever remember them. You know, just like me and you don't remember all the hits we've had, right? And traumas,
Exactly.
right?
Exactly.
You know, you just kind of forget about them. But the results can remain. That's why we do the testing.
Thank you, John.
Thank you.
Dr. John Nowicki with us on In Touch. For In Touch, I'm Aaron Harper.